Hi guys, it's Dave. Today we're going to talk about diverticulosis and a complication of that, diverticulitis. These are both disease states that affect the large intestine. With diverticulosis, you get small bulges or pockets that form in the lining of the intestine where the areas of the intestine become weak over time and these bulges occur. These can become inflamed or infected. When that occurs, you actually get diverticulitis. The majority of patients with diverticulosis actually don't even have symptoms, and 75% of the time you won't even know that you have this going on. So only 1 in 4 actually develop symptoms. You'll get lower abdominal pain, you'll feel gassy, bloated with an extended abdomen, and mainly it's going to occur in the lower left hand side. There is one exception, and that is in the Asian population, the pain will actually occur in the lower right hand side, and that's just a genetic factor that is causing that. If you get diverticulitis, where there's the inflammation that actually occurs or the infection, the pain will be more severe and it will be a constant pain throughout the day. Along with that, you can get constipation, severe constipation. In a few cases, you may actually see diarrhea, but for the most part, it's constipation, and you will see a high fever combined with that, along with some nausea and vomiting that's also possible. It's known as a Western disease, and the reason for that is in the Western diet, we don't get the amount of fiber, the amount of fruits and vegetables that we need to get. If you go to Europe, you will eat bread with every meal, or you'll have a lot of pasta, so they're getting a lot more fiber than we do. And then, of course, there's genetics that also play a part in that as far as it being a Western disease. It is something that can reoccur. So you want to be aware that, you get it once, it goes away, or maybe you treat it, the diverticulitis, it goes away, and you think you're done. Not necessarily. It can reoccur unless you're taking steps to make things better. Risk factors for diverticulosis and diverticulitis are smoking. If you're a smoker, you're going to be more prone to have it. Obesity is something else. You're going to have pressure that's applied in those areas where those bulges will occur. A lack of exercise or a low amount of exercise can also be a risk factor for that. A history of having constipation and severe prolonged constipation. People over the age of 70, and actually in men, it's over the age of 50. So men are more prone to get this at a younger age. A history of use of NSAIDs or ibuprofen, naproxen, diclofenac, drugs in that class will put you at a higher risk for that, as well as a genetic component. So if you have relatives that have this, especially relatives that have reoccurring diverticulitis, you're going to have a higher risk of getting it. 1 in 4 can get complications with this disease, and those complications can be abscesses where they become severely infected, bleeding which occurs, blockage where you're not able to go to the bathroom and it's not able to pass, a fistula, which is a passageway between the intestine and other areas of the intestine or other organs that is not normally there. So it's a not normal passageway where that occurs. Or even peritonitis, and this is where the contents of the intestine actually spill into the bowel cavity. And that can be, you're at high risk for having an infection with that. So you really want to get that taken care of if you're having these symptoms and they're prolonged. A CT scan or a colonoscopy will actually show what's going on, and if you're having a prolonged time where you're dealing with this abdominal pain with a severe constipation going on, you need that to get that done to rule out any of these other severe complications as well as cancer. The treatment for peritonitis, basically you'll get an antibiotic and you'll start to see a turnaround in about 3 to 4 days. But rest, fluids, Tylenol for the pain. Laxatives are also something that can help with the constipation if that's what you're going through. Obviously, if you have diarrhea, you don't want to be looking at that. And eating liquid food, avoiding solid foods is one of the main things so you don't get that blockage. So as much liquid type food as you can get in will help. Now, as far as prevention, what can you do? Or if you have diverticulosis without getting to the diverticulitis part where it becomes inflamed or infected. Number one, if you're a smoker, quit smoking. Very important. At least reduce the amount of cigarettes you're smoking a day. Number two, increase your fluid intake. That's important. Number three, increase your amount of exercise that you're doing every week. The more exercise you get in, the better you're going to be. Losing weight will also help you as well. Increasing your fiber intake, that's very important. Whole grains, 4 to 5 servings of fruits and vegetables a day will really help you out with that. Nuts are also something good, a good source of protein. And the fact that it's basically a myth saying that nuts and seeds will cause diverticulitis. They won't, and they're a very good source of protein for that. And then something that's kind of mixed is probiotics. Some studies say that it will not necessarily help you with that. Some studies say they will. However, they are not going to hurt you. And the more we've seen with the microbiome of the gut and the gut-brain axis, they will help you. Make sure you get a good one.